Greetings, and thank you for tuning in. I'm Dr. Andrea Walker, family nurse practitioner. In today's episode, we will discuss microdosing GLP-1 medications. Microdosing GLP-1 medications refers to administering lower than standard doses of GLP-1 receptor agonists, such as semaglutide and tirzepatide, often for the purpose of making weight management more tolerable, mainly as it relates to the side effects a person can experience with these medications. Many people will start GLP-1 meds, but eventually stop them due to the side effects. For those users, microdosing can be a game changer. Here's a little background information on the meds. Since these medications mimic the naturally occurring GLP-1, glucagon-like peptide 1 hormone, that our bodies normally produce to help regulate appetite, blood sugar levels, and insulin secretion, leading to weight loss, you can get even more benefits when injecting the synthetic version of the GLP-1 medications. This is why they are so popular. According to the manufacturers, the injections are meant to be injected subcutaneously on a weekly basis with specific dosing schedules. For instance, tirzepatide, which is generic for Mounjaro and Zepbound, is dosed starting at 2.5 milligrams, 5 milligrams, 7.5 milligrams, 10 milligrams, 12.5 milligrams, and maxes out at 15 milligrams. Basically, the dose goes up 2.5 milligram with each new dose, and it is recommended for users to remain on each dose for at least 4 weeks before moving to the next dose. However, you can remain on each dose for longer than 4 weeks. With semaglutide, which is generic for Ozempic and Wegovy, dosing starts at 0.25 milligrams, 0.50 milligrams, 1 milligram, 1.7 milligram, and maxes out at 2.4 milligrams. Again, the manufacturer recommends that users remain on the same dose for at least 4 weeks before moving to the next dose. However, due to the side effects of the medications and the large jumps in doses, some users are not able to tolerate the side effects. This is where microdosing can be of significant value and provide tremendous benefits. So, let's get started with the value of microdosing GLP-1 medications. So, how does microdosing work for GLP-1s? Let me start out with saying this. Microdosing works great for patients taking the compounded version of semaglutide and tirzepatide. The reasoning behind this is because the medication comes in a vial and the user is able to draw up the recommended amount of medication into a syringe prior to injecting the medication. The compounded versions are not pre-measured out the way they are with the brand medications, Mounjaro, Zepbound, Ozempic, and Wegovy. Let me explain even more. For instance, with the compounded version of semaglutide, 40 units in a syringe might be equivalent to 1 milligram of semaglutide, and 20 units in a syringe might be equivalent to 0.50 milligrams of semaglutide, which are both recommended doses. Well, with microdosing, the patient could be told by their healthcare provider to inject 30 units, which is obviously in between 20 and 40 units. But why would a healthcare provider recommend this type of dosing? Here's why. Microdosing can be beneficial for several reasons. Lower initial dosing. Microdosing involves lowering the dose of the GLP-1 medication, which might help the body gradually adjust to its effects. Lower doses may reduce the intensity of side effects such as nausea, vomiting, or diarrhea, which are common with standard GLP-1 doses. And then there's gradual dose escalation. In microdosing, the dose can be slowly increased over time to allow the body to adapt without causing significant side effects. This may involve taking smaller than the usual increments, such as 0.25 milligrams or less, instead of moving quickly to a full dose. It allows for a more personalized approach where patients can increase doses slowly, helping the body adjust to the medication and avoiding sudden or drastic changes. So that goes back to the example that I gave you in the beginning. You don't have to go as recommended from the 0.25 to the 0.50 to the 1 milligram. You can go from 0.25 to in between 0.25 and zero point 0.5. You may go a couple of doses in between the 0.25 and zero point 0.5. However, this is something that your healthcare provider needs to do and not you. And then other benefits of microdosing: appetite regulation. Even at smaller doses, GLP-1 drugs can still have an appetite suppressing effect, helping people eat less. Microdosing may provide enough of this benefit without overwhelming the body, especially individuals who are sensitive to the full dose. And then there's weight management and glycemic control. Although full dose GLP-1 medications are more potent for weight loss and glycemic control, some users may experience a more moderate but still helpful effect from microdosing. This could include milder reductions in hunger, gradual weight loss, or blood sugar improvements. And then tolerability and adherence. For people who struggle with the side effects of full dose GLP-1 medications, microdosing might offer a more sustainable way to stay on the medication. This could lead to better long-term adherence and outcomes at a slower pace. Now, keep in mind, microdosing is considered off-label use. There's nothing wrong with that, but microdosing is not the standard prescribed approach for GLP-1 medications. This means it should be done under the supervision of a healthcare provider to ensure safety and effectiveness. Now, let's talk about several reasons why GLP-1 medicines can be a good thing to microdose. Kind of went over them before, but I'm going to go over them a little bit more. Fewer side effects. Like I said, some people will really like the medications, but then they will stop because they're either just too fatigued or too much nausea, or maybe it's the belching or burping that they just can't tolerate. Even with some patients, it may be the loss of hair, and that's a whole nother story, but usually that's diet. But it may be that the medication is just working so well that you don't really need that particular dose, and you can go down on the dose, which would be microdosing, to lower the side effects. And then another good reason would be sustained weight loss. Even at lower doses, GLP-1 receptor agonists can still help with appetite suppression and satiety, potentially leading to gradual weight loss without overwhelming the body. And then this is a big one. I think this is why a lot of people microdose or want to microdose. Lower costs. Microdosing might offer a cost-effective option, especially for those who cannot afford full dose treatment. As you know, with most places, the higher you go up on the dose, the more the medication is going to cost. So a lot of times people do want to use lower doses so that their medication can last longer. And then personalized dosing. This is what I like. All providers will not provide microdosing, so if this is something you are interested in, you will want to make sure to discuss this upfront with the clinic or telehealth practice you decide to choose. Because normally, again, let's say with semaglutide, the dosing is 0.25, 0.5, 1, 1.7, and then 2.4. No in between doses at many practices. However, with personalized dosing, which means it's adjusted according to you and how you're tolerating the medication and the side effects, your doses don't have to be those typical standard doses. And then you still can get the metabolic benefits. These medications can help improve insulin sensitivity, blood sugar control, and reduce the risk of cardiovascular disease, even at lower doses. So, I won't really get into this, but a lot of people or a lot of providers now are microdosing the GLP-1s, and it has nothing to do with weight loss. They're wanting to do it for other benefits, which is perfectly fine because they want those metabolic benefits as well, but they don't need high doses, and weight loss is not their ultimate goal. And then long-term sustainability. Some people find that microdosing is easier to sustain over time as it causes less disruption to daily life. Now, on the flip side of that, microdosing GLP-1s is not for everyone and could be a bad thing. And the reason why, it could lead to reduced effectiveness. At lower doses, the medication may not work as effectively for weight loss or blood sugar control compared to the standard dose. And then you may have slower progress, which personally, I'm okay with that, but a lot of patients want to see much, much quicker progress. But with this slower progress, weight loss might be slower or plateau more quickly, which can be frustrating for people seeking quicker results. And then it may lead to insufficient appetite control, which we don't want. Microdosing might not suppress appetite as effectively, leading some people to overeat or regain weight. And then for those who do take it for the treatment of diabetes, for those using GLP-1 meds to manage type 2 diabetes or even with their prediabetes, microdosing could result in suboptimal glucose control, potentially leading to higher blood sugar levels and complications. So, of course, it's not for everybody. And then there's the potential for overuse or abuse. There is a risk that people may use microdosing as a strategy to avoid side effects, but end up using the medication in unregulated patterns, which is a concern of mine. As long as you're in communication with your healthcare provider, then great. But many users, especially those who use telemedicine practices, will adjust the meds on their own, which I do not recommend. So please understand that microdosing GLP-1 medications is not typically how these medications are prescribed, and adjustments in doses should always be managed under the supervision of a healthcare provider to ensure safety and efficacy. Microdosing should only be done under the guidance of a healthcare provider who is trained to microdose and who knows what they're doing, as it may not be appropriate or effective for everyone to microdose, and especially for those with severe obesity or metabolic conditions. So keep that in mind. Hope everyone now understands what microdosing is and the purpose of it. Again, it is considered an off-label use, but it will work well for many. Microdosing GLP-1s is actually not new. In 2018, I traveled around the United States to family practice clinics and educated them on one of the older GLP-1s, Saxenda, with the generic name being liraglutide. Many of the providers were already microdosing Victoza, which is generic for liraglutide as well, because they learned that was the only way that their patients could tolerate the medication. And it worked. It did not cause any harm, and the patients were able to continue the medication and reap the benefits. And again, microdosing will not work for everyone. Some users actually want to microdose their medication, maybe to save money, but not because of the side effects. But then they are disappointed that they are not seeing much weight loss at all. For them, microdosing might be a waste of money, even though they feel they are saving money, but they are not seeing the results. If the dose is too low and you're not seeing any benefits, then I would not suggest microdosing. Many individuals will do well with the recommended dosing schedule, but for those who do not, then microdosing is definitely an option. I hope you enjoyed today's episode. I'm Dr. Andrea Walker, owner of Dr. Andrea's Medical and Weight Loss Clinic located in Cordova, Tennessee, and owner of Telehealth DNP, where I treat patients online in Florida and Arizona. For more weight loss tips, you can follow me on Instagram or Facebook under either business name, or you can even follow my bodybuilding page on Instagram under fitness underscore chick, CHIC 29 underscore IFBB underscore pro. I hope you have a productive week. Get some workouts in. Don't forget to meal prep, and I will see you next week. Until then, bye for now.